Case 40, 2016, a 14-month-old girl with recurring vomiting. Definition: cyclic vomiting syndrome, sometimes referred to as CVS, is an increasingly recognized disorder with sudden, repeated attacks, also called episodes of severe nausea, vomiting, and physical exhaustion that occur with no apparent cause. The episodes can last from a few hours to several days. Episodes can be so severe that a person has to stay in bed for days, unable to go to school or work. A person may need treatment in an emergency room or a hospital during episodes.
Who vomit and to the point of dehydration come into emergency rooms repeatedly as if they have the stomach flu, but it keeps happening over and over again, and usually misdiagnosed as they have the stomach flu, they have food poisoning, but it happens 10 to 15 times. And one of the special features besides vomiting is that the children are extremely nauseated, and they usually have the same kind of attack. In other words, it starts at the same time, it lasts the same number of hours, so it's very what we call stereotypical. Each episode seems to be the repeat of the previous one, and that argues that it's something within them rather than a different virus each time. We do believe that it's a cousin to migraine headaches, and there are several things that say that usually there are lots of migraines in the families of the child, in your family. Secondly, when the child gets older, oftentimes they will end the vomiting sometime during their teenage years, but unfortunately trade it off for migraine headaches. And so we do think there's a strong relationship to migraine, and in fact, most of the medications that we use are not GI medications, but they're actually anti-migraine medications. I will tell you that many of the parents are the ones that have actually brought the disorder to their physician's attention and help the physician make the diagnosis. So I really recommend that parents be very proactive in looking for information. There's enough information out there, they can tell whether their child is a good match for the disorder, and bring this to the attention of their doctors.
Applications in medicine. The cause of cyclic vomiting syndrome is unknown. However, some experts believe that some possible problems with bodily functions may contribute to the cause, such as the following: gastrointestinal motility, the way food moves through the digestive system. Central nervous system function includes the brain, spinal cord, and nerves that control bodily responses. Autonomic nervous system functions, nerves that control internal organs such as the heart. Hormone imbalances. Hormones are a chemical produced in one part of the body and released into the blood to trigger or regulate particular bodily functions. In children, an abnormal in gene may also contribute to the condition.
Dr. David Hill, and today we're going to talk about how to treat vomiting in children. Now, everybody knows children get sick, they throw up, and how to treat that depends in part on why they're throwing up and how much they're throwing up. The good news about vomiting, if you can say that there's good news about vomiting, is that even with the most dramatic episode of vomiting, there's still something left in the stomach. That's been the key to what we call oral rehydration therapy. We know that if we can get fluid into the stomach, even if children are continuing to vomit, there's a decent chance that enough fluid will be absorbed by the body to prevent dehydration. The idea is not to fill the stomach up with a lot of fluid all at once, which we think may cause more vomiting, but to dribble fluid in a little bit at a time. Ideally, we say 1 teaspoon of fluid every 2 or 3 minutes. An easy way to do that is to sit on the couch with your child, perhaps watching television, and every time a commercial comes up, give them a couple of sips. People want to know, what should I give my child to drink? Well, the ideal rehydration fluid is invented by the World Health Organization, but it includes a lot of salt, and a lot of sugar. Ideally, the balance has 1-to-1 molecules of salt and sugar because that's how the body absorbs water. Unfortunately, that solution doesn't taste very good, and it's not very popular with children outside of the underdeveloped world where it has been a life-saving therapy. In the developed countries, an alternative is electrolyte solutions. Brands include Pedialyte, Enfolite, and K-Electrolyte. These are sort of a watered-down World Health Organization electrolyte solution. They won't truly rehydrate a child, but they will prevent any further loss of fluids when used properly, again, with frequent small sips. In older children who are taking more solids, you can try and balance out the fluids going in with bland solids, especially those containing salt, things like soup or saltine crackers. Ideally, you don't want to give the children any solids until they've stopped vomiting for about 8 hours. So stick with just clear fluids for the first 8 hours of vomiting. After that, you can start advancing to fluids like soup and then on to bland solids, assuming the vomiting is going away. Now, we want to be on the lookout for some things that suggest danger, signs that your child needs to be seen immediately by a physician. Vomiting up blood or stuff that looks like old coffee grounds, which is really blood that's been in the stomach for a little while, is never a good sign. So if you see that, you really want your child to see the doctor. Vomiting accompanied by frequent watery diarrhea could lead to dehydration relatively rapidly. That's another reason to have a child seen rather emergently by a physician. If your child
Pros and cons. Pros: administration of romibedrectin or codeine hypodermatically will avert most attacks in a few hours. In the intervals between attacks, the child should be given to a full, nourished diet. There is no reason for a dressing of fats. Cons: the severe vomiting and retching that defines cyclic vomiting syndrome increase the chance of developing several complications, including dehydration, esophagitis, and Mallory-Weiss tear and tooth decay.
Email from Janet in Raleigh, North Carolina. She writes, whenever my kid gets a case of vomiting, it freaks me out and I want to run to the ER. My husband says not to panic. How do I know when to make that trip?
Oh, man. That's probably one of the other big calls I get. My child just threw up. What do I do? And I usually say, well, start by cleaning it up. And then so let's see how it goes. If sometimes kids just vomit once and that's it. Sometimes it goes over and over and over again, and sometimes it could be a stomach virus or food poisoning, or even it could be something serious like an intestinal obstruction. And that's the real key, is when to worry about it. And the bottom line, if you're not sure, if a parent's worried, call your doctor. But there's a few rules that we use, and I'm going to show you a few of them here. If your child's under 12 months of age and they've been throwing up for longer than 8 hours, it usually warrants a trip to the ER. If between ages 1 and 3 and you've been throwing up for about 12 hours, that's when you worry. And then over about age 4, and if it's been going longer than 16 hours, time to at least call the doctor or go to the ER. Now, there's a few other things too. Sometimes a child will throw up blood, and that causes a big panic in parents for sure. And if it's just a little blood and it just happens once, I usually don't worry about it. If it's a lot of blood, it could be a little tear in the lower esophagus, and that usually requires some prompt medical attention. Other things, oftentimes the color of the throw up is important. Oftentimes a child, if they throw up, if they've been drinking milk, you're gonna see this kind of color, the yellowish colors. That's usually milk. If there's some green in it, so if you see this color here, this is kind of the color of bile, or really just any kind of dark green. That usually means it's bilious vomiting, there's bile in there, and it's a medical emergency. And there's one more danger sign. If your child's vomiting and is complaining of a stiff neck, that's usually a sign of meningitis. Definitely time to go to the ER.
Great idea. Thanks, Dr. Sears.
You betcha.
Issue applied in Ecuador. Cyclic vomiting syndrome is more common in children than adults, although reports of the syndrome in adults have increased in recent years. Usually, children are about 5 years old when diagnosed with cyclic vomiting syndrome, which occurs in every 3 out of 1,000 children.
I'm Dr. Varsha. I'm a consultant pediatrician, visiting consultant at Narayana Multi-Speciality Hospital at HSR Layout. Vomiting in children should not be taken lightly because the child, if is persistently vomiting, then it can lead to dehydration. If the child is occasional vomiting, maybe there is some indigestion with the food he has taken, and it will subside on its own. Give him light food, and he can take electrol ORS solution from the market, and he can take sips of ORS solution rather than giving the whole glass, because this will control the vomiting. If the child is persistently vomiting, it's better to show to the pediatrician, and they can prescribe some anti-emetic drugs to control the vomiting. But in any case, if the child is vomiting, we can have sips of water consistently given to the child so that he is well hydrated till the pediatrician is being consulted.
Conclusion. The effect of treatment with sedatives or analgesics in both conditions also points to a conclusion that recurrent vomiting is a childhood equivalent for migraine. The disorder can affect a person for months, years, or decades. People with cyclic vomiting syndrome should get plenty of rest and take medications to prevent a vomiting episode, start an episode in progress, speed up recovery, or relieve associated symptoms. During the well fast, a balanced diet and regular meals are important. A healthcare provider will assist with planning a return to a regular diet.
To have such a beautiful family and a beautiful daughter. That's great. But I know as a mother, you feel everything that your kids feel and tenfold. So that must have been just awful for you not knowing.
The thing with cyclic vomiting is until people figure out that that's what it is, you have to be tested for everything. So she had an endoscopy, she had upper GI, she had CTs with contrast, she had every single thing you could possibly have. But if you're in the middle of a vomiting episode, a lot of the things you can't have because you can't hold down the contrast fluid. So you end up having to wait, a while and then have the test.
You raise such a good point, because the things that are most commonly misdiagnosed are the ones that are the most difficult to diagnose. So if you come in with appendicitis, we can figure it out pretty quickly. If you have a urinary tract infection, you can figure it out pretty quickly. But cyclic vomiting, if you're going to see a doctor and then 2 months later maybe you see a different doctor, both of those docs are going to think, well, you just probably have a stomach bug.
Right.
Especially
and treat
when
it that
all
way.
the other patients are seeing that day have the stomach bug.
Yeah, you have to know what cyclic vomiting looks like. And the thing that all CVS patients will talk about is the overwhelming, unrelenting nausea. That's what it's about, more so than the vomiting. That's just the byproduct, basically. It's this sensation of nausea that will not leave. So what happens to children in particular is they basically have to figure out how to maintain themselves. So they have to put themselves to sleep. They have to not move. They have to be in dark places, because the only thing that they can think about is that next wave. But the thing about it is, when it's done, it's done. You've got your kid back.
And I do want to introduce Dr. Richard Bowles, a medical geneticist from Children's Hospital, Los Angeles. Like Chandra mentioned, one of the leading researchers in cyclic vomiting syndrome. And this is a syndrome a lot of people aren't familiar with. Do we know what causes it?
Cyclic vomiting syndrome is actually very common. About 2% of all school-aged children have CVS. Like any common disorder, it has genetic and environmental components. One of the genetic components is in the mitochondria, or the part of the cell that makes energy. So that's one of the causes, but we're still doing more research to figure out the whole syndrome. Many patients never get a diagnosis.
And of course, the reason we're bringing this to light today is not only because of Serena, but treatments. You've been researching treatments for this condition and have found some very effective ones.
First of all, there's medications, the same medications that are used in migraine, depression, irritable bowel, chronic fatigue, and many of the other conditions which cyclic vomiting syndrome is related to. There's also certain vitamins which are used in extremely high doses, which act to make the mitochondria make more energy.
And you said something during the tape. If you're a parent at home and every year your child's getting diagnosed with the stomach flu repeatedly, and in between those bouts everything's fine, you've got to think about cyclical vomiting syndrome.
And I see that as a pediatrician. I've seen that a few times in my career. This is a good example of when, as a parent, if you think there's something else going on, don't be afraid to talk to the pediatrician and say, you know what, I've